My daytime job, my 9 to 5 to my 5 to 9, I'm a speech therapist. And when I went into the field, I had no idea what that entailed. If you are in undergrad, high school, if you are getting back into the swing of things with education, I highly recommend checking out this field. We are givers. We are healers. The majority is a type A crowd. So I'm going to give you that fair warning, because when you go into grad school and you're looking around, yikes. As defined by ASHA, speech-language pathologists work to prevent, assess, diagnose, and treat speech-language cognitive communication and swallowing disorders in children and adults. Within that, we have 9 different domains that we work with. We have the speech sounds articulation, so that's what people primarily think of when we think of speech-language pathologists. We're going to work on saying TH, the, or we're going to make sure our lips are pulled back when we say R, so we don't make a W. We have language disorders. When kids use language, when they understand language, are they following directions? We have social communication, and this is just in terms of greeting individuals. Can you take turns? Can you exchange? And I have caveats and my own thoughts and opinions on that, which, again, whole other video. We have cognitive communication. So the disorders includes organizing thoughts, paying attention, memory, executing their plans. We have dysphagia, so how people swallow. We have the muscles in our throat, and sometimes if you have head and neck cancer or neurological disorders, we have like individuals who can't swallow because they had a stroke, and so getting that back and coming up with the compensatory activities, that's their scope. Honestly, I am not into dysphagia like I thought I'd be. And within these realms, there are whole other dynamics. For example, we look at ethics to make sure that we are utilizing ethical behaviors, documenting that we are using diverse considerations, especially when it comes to dialectical differences or accent modifications. We have also oral rehabilitation considerations, so looking at deaf and hard of hearing individuals. We have augmentative and alternative communication systems, AAC. One of my favorite things about the field, I love getting a kid with an iPad and having them just unleash what is communication, giving them that modality. Now, SLPs can go in so many different locations and areas. So, for example, I'm pretty niche. I am a virtual speech therapist in the schools, and it's fun. I actually thoroughly enjoy it. You can be in person at schools, middle schools, preschools, high schools, elementary schools. You could be working with kids with excessive expressive receptive language disorders. You could be working with kids in life skills who do require the use of AAC at times. You can be in an outpatient facility, and here you might see pediatrics, so you might get a little more variety in your cases outside of speech sounds and language, which is primarily my caseload. You also might have outpatient centers that include adults, and you might get more of that cognitive communication. They may have experienced a stroke and they have aphasia, which is a neurological disorder of communication. Sometimes they might have difficulty getting words out or understanding, comprehending words. They might be grammatically incorrect. And so you might be treating individuals with that, or you might even see dysphagia. Another setting is within hospitals. You can get acute care, so working with swallowing and making sure that individuals who are experiencing any kind of a stroke or that they're safe to swallow, head and neck trauma, making sure that they are getting nutrition in a way that meets what their body's demanding right now. So if you can also get TEP ports when people are experiencing some more adverse effects. They might get a TEP port, and so you'll clean that out, and then they will communicate utilizing like the closure and whatnot. Again, this is not my specialty, just parts of the field, dipping your toes in it. You have nursing homes. We have cognitive communication, so helping people communicate if they are experiencing any kind of aphasia, if they are approaching a more progressive disorder like Alzheimer's, you're using compensatory methods to help them communicate and still practice their daily life. You're also working with swallowing. Again, going back to making sure people are consuming food in a healthy manner that meets their needs. You have people with Alzheimer's who are slowly losing the ability to physically and even mentally know that they need to swallow. And similarly with people with strokes, they may not have the muscle function needed. They might need to turn their heads in order to help them swallow if they have weakness on one side. I still retained it, guys. I still retained some of it. And with that, and hospitals will do this too, you'll also be participating in swallow studies. And so basically you'll go into a x-ray room, radiologist, and you'll take action shot of them swallowing different thickness of liquids and solids. And we have one of my favorites, early intervention. When I was fresh out of grad school, and I had never done it because I went through my graduate career, the latter half, through COVID. So I was like, oh my goodness, I haven't held a 2-year-old in so long. I loved this field. I loved this area. And with it, I went home to home across the city of Chicago and just got to know so many beautiful families and just like was immersed in their culture. And you essentially help a 2-year-old learn how to say their first words and communicate with their families to get their needs and wants met. It was absolutely delightful and I loved it. I miss it. There are other types of home health. You can be a home health practitioner for adults, go home to home and really help them get their needs met. And it's really nice because when you are participating in home health, you're able to use materials that that individual would use within their comfort, within the comfort of their own home. For example, I would not bring any games. Like maybe I'd bring like 1 or 2 things, spice things up. Kids love the novelty. But when you go in, you teach parents or you teach the adult to utilize the materials they have in order to best generalize what they're learning across their own materials so they could do this without you in the session. And that leads me to counseling. A lot of what I learned in the first year of grad school or the first year in my clinical fellowship was we help parents. We help parents and individuals learn and cope with what's going on. And so really allowing the parent or the adult or even the child, that individual, to get all of their concerns out on the floor to make sure that that individual knows that they are a part of the team. They're an integral part of the team and their desires, their concerns, everything's being heard and answering any questions that they may have, as well as saying, I will look into it, but I can't answer that right now, is another way to, once again, build that rapport. Making sure you have a positive relationship with all of your clients and relationships is so important. I think that's one thing about maintaining motivation within the speech therapy session. Now, the way to become a speech therapist is you typically do 4 years of an undergrad. Within programs, some programs are different. Some programs have 5 years, including the master's. But after the 4 years, you would go on to do a 2 years master's program, which I did. And I did it at the same university, so really it wasn't crazy different. So you'll get more hands-on experience within grad school. Your studies will be more tailored to speech and language rather than gen eds or psych or anything else that you may have. And there are some crossovers that you will see in grad school, especially with neuroscience, which is one of my favorite topics. And then after you graduate, you will get a clinical fellowship. And this is typically a 9-month program. It's 1,250, weird number, hours that you must maintain under the supervision of a actual practicing licensed speech language pathologist. And now they're not always with you 24/7. I think there are a specific amount of hours that they must observe your sessions, but for the most part you're on your own. They will read and co-sign your documentation, and for the most part they will like make little comments, and it was cute because mine was like, oh, like she's doing so well whenever one of my clients made progress. I'm like, hell yeah. And you know, that's a person that you will maintain a relationship with outside of that clinical fellowship, and it's kind of cool once you get to that point where you're like, wow, I'm really in this. I hope this really opened your eyes to all that is speech pathology. I can do a whole other video on why I chose the field. The thing is, we go into school really not knowing what speech language pathology is, and that's why I'm continuing to create this account. I hope you enjoyed, and I'll see you next time.